I'm Marty Makary. I'm the editor of MedPage today, and I'm learning about startup companies here at the Startup Festival. We've got Marcelo Venegas here. Hey, great to see you.
Great to see you
Nice,
as well.
good to have you here.
Likewise.
Great. So, tell us a little about what you're working on. This company called KnowNOW.
Yes.
And how'd you get into it, and what does it do?
So I founded KnowNOW Health. I'm a practicing physician. We got together with 5 other physicians who we trained together in the Bronx, in New York. And our whole moonshot is access to care.
Okay, you do primary care?
I do primary and specialty care.
Okay, great. What specialty?
So I do HIV care, and
Okay.
I've been practicing doc in terms of HIV care for the last 14 years now.
God bless you. Thank you for what you do.
Yeah, thank you, absolutely. So for us, it's really about access to care, and it's looking at health disparities, and we got together and we said we want to create a solution to the problem using technology. So we created an app that was launched in last year, July of 2000.
To help people navigate to find primary care?
Right, so we created, first we started doing STD testing and what is called PrEP, which is 1 pill a day to prevent from getting HIV. And of course, PrEP came out almost 5 years ago now, and the number of people who use PrEP is very, very low. And so that was just the beginning.
People just feel resilient. They don't need to take anything like
well,
that.
Well, you know, it's really a public health approach to a serious disease like HIV. And so it's a bigger conversation. And we got noticed by the AIDS Institute of New York, and they said, we want you guys to work on a better solution to the big problem we have. So we said we're going to use our technology to democratize technology. And what we ended up doing is using our own app or technology, we're using it and getting it available to federally qualified health centers in New York. And insurance groups jumped on, and now we're actually using our app in Latin America as well.
Is that right?
So yeah, it's really exciting. Yeah, so we're working with a group. I'm originally from Chile.
Oh, okay.
And we're working with a group in Chile that does street health. And so we got the app to them as well. And the app is really just a great way to communicate through telehealth, using texting with patients, but also a way to communicate and to have data. And so we talk of EMRs here. A lot of places, underdeveloped countries, don't have EMRs. And so we're essentially becoming their EMR.
Okay, so how's it work? I mean, obviously, there must be a way to identify at-risk populations and then recommend the app to them or advertise the app?
It's people who've been doing this for decades, so, like the FQACs are a safety net here in the United States.
So they've got their own HIV populations and at-risk populations,
Right.
and they can offer the app.
Absolutely.
Okay, so if you're a primary care physician or a doctor that's focused on one of these at-risk populations, or you take care of an HIV population, this may be of interest to you.
Yeah, so especially like weekend hours, after hours. I just saw a patient the other day, he's like, I don't want to come see you because AIDS is part of the clinic name. And I said, maybe in 2 months we'll have the app up and going. And then for one particular organization I work with, we're getting the app to them. And then you don't have to come to the clinic. We can see you from your living room, So
it's addressing that stigma that still is out there.
Absolutely.
That's a real barrier to care.
You're disabled, you're a working parent, telehealth, as we already know, so many other companies. Our goal is to get it to those people that serve underserved communities. We're really passionate about that. And, it's really, 30 million uninsured in America. If you're poor, you already have less health than somebody who is better off. And so we really want to get out to those people who need that care and that technology that may not be getting.
Well, Marcelo, what a great idea. For all the downsides of new technology out there, here's something that can actually address the barrier of the social stigma, that access barrier.
You nailed it. Yep, that's exactly it.
So that's so cool.
Yeah,
that's really cool.
And then the other part to it, that it's not just technology; it's who's behind the technology. Yeah. So I think the providers we have are excellent. The people we're working with provide excellent care. And so we're really excited about that.
Great. Well, good luck, Marcelo.
Thank you so much.
Thanks for sharing about your company here.
Yep.
It's called KnowNOW.
KnowNOW Health.
And it's available. It's out there on the web. And
Absolutely.
Doctors who take care of these populations can be ideal doctors to use this.
Definitely.
Great to meet you, Marcelo.
Thanks, Marty.
Okay, great.